Are you often troubled by back pain? Every day in the morning when you get up, back pain is there. Your day-to-day activities, climbing stairs, everything is becoming very, very difficult for you. You do not remember any moment or any time of the day without back pain. You often feel frustrated, agitated because of this back pain. You want to do many things like trekking, road trips, gymming, but you cannot do. You're missing out on so many fun activities. You feel restricted and bound in your own body. If yes, then I have a good news and a bad news for you. Let's hear out the bad news first. No doctor, surgeon, physiotherapist or chiropractor can give you full relief from your back pain problem. They cannot give you a long-term solution. Well, the good news is you can do it by yourself. Doctors can only fix your problem for that moment. But if you want a lifelong solution or result, you have to work on your own self so that you can get rid of your back pain problems forever. And how can you do that? Well, that is what you are going to get today in this video. We are going to discuss what is back pain, how does it happen, why it affected you, what you must do, what you should avoid at any cost if you want to prevent back pain. While you are having back pain, how can you get relief without taking any medications? And also, how should you sleep so that you will not have back pain in the morning? Well, you are going to get answer of all these questions in this video. So do not skip any part of it. Every line is very significant, very important. So watch this video till the end to avoid your back pain problems forever. Hello friends and welcome to your channel My Expert Doctor. I am Dr. Shalini Singh Salunke, your consultant physician, your health guide. And today we are going to talk about back pain problems. Now, back pain has become one of the most common health issues since last decade, and it has increased tremendously or exponentially after COVID-19. Well, if you'll ask me, the main problem of this rising trend of back pain issues after COVID-19 is a new culture of work from home and work throughout the day, almost 10 to 14 hours in the same position, sitting whole day in front of your laptops. This is especially the case of IT professionals, and the situation has worsened so much that couple of days back I saw a young 30-year-old man coming with his father, 60-year-old man, and both of them have come for the back pain problem. So if you want to make your back strong, hop on board because we are going to discuss steps of getting rid of back pain problem. So first of all, let us understand what is back pain and how does it appear. So before that, you have to understand the spinal structure. Now if you can see, our spine has a particular curvature and the spine is made up of bones stacked together and they are kept in place by strings which are called muscles. Then in between each strand you can see some cushion-like structure which is called disc. It acts as a shock absorber, and in the center of these spinal structures of vertebra we have spinal cord, and the spinal cord is actually a bundle of nerves. So from each exits or foramen, the nerves exits and get distributed to various parts of the body. So we have bones called vertebrae, we have muscles, we have disc and nerves. So if any of these four structures get damaged, you will have back pain. Now if you don't take proper measures to get rid of this back pain at this point, it will further progress to a point where the nerves start getting damaged. And when the nerve starts getting damaged, you might experience tingling and numbness sensation over your hands, feet, and in further stages it might reach up to weakness of the muscles. Now once your muscles start getting weaker, you will find it difficult to walk, get up from your chair or from your sofa, climb the stairs and all. And in the worst case scenario, you might land up into wheelchair or even bed. You won't be able to walk or move at all. So I hope now you understood why taking care of your back is so important and so crucial. Now let's move on to the next point where you will understand why you developed this back pain problem. So if you are over and above 45 years of age, if you are tall, height more than 5'10", if you are overweight or obese, if you do not do regular exercise, your weak is back, your core muscles are not that good, you have sedentary job or you have job where you have to lift heavy objects, you are constantly under stress, depression or anxiety because stress and depression release hormones like cortisol which weakens your bone, or you smoke, or you are pregnant, you have disease called arthritis or other diseases which make you more prone to fall, or you are on certain medications like steroid, or you have a poor posture. Now if you belong to any of these categories, you might develop a problem of back pain issues. Now you'll ask me, this list is so huge that anyone and everyone could be a part of this problem. Well, yes, that is why in 2021 WHO released a data in which they mentioned that every 8 out of 10 people have back pain problems. At some point of your life, you will develop back pain problems. So you have to understand what you need to do and what you need to avoid to prevent this problem or to minimize the risk. So now let's move on to the part where we will learn what we are not supposed to do to keep our back strong. First, never lift with your back. Always lift the heavy objects by bending your knees and using your legs, not by bending your back. Lifting with your back puts too much strain on your spine and can lead to injury. Second, never sit for too long. Sitting for long periods, especially in a poor posture, can cause your muscles to stiffen and your spine to misalign. If you have to sit for extended periods, take regular breaks to stand up, stretch and walk around. Third is never ignore your core strength. Weak abdominal muscles and back muscles can lead to poor support for your spine. Skipping core strengthening exercises can make you really prone to back injuries. Fourth, never sleep on a poor mattress. A mattress that is too soft or too firm can cause your spine to fall out of alignment during sleep, leading to back pain. Use a supportive mattress that keeps your spine properly aligned. Fifth is never slouch. Poor posture, whether while sitting or standing, can place extra pressure on your spine. Avoid slouching and maintain a straight upright posture. Sixth is never overexert yourself. Avoid pushing yourself too hard, especially when exercising or lifting heavy objects. Gradually build up your strength and be mindful of your body's limit. So keep in mind that you have to avoid these 6 mistakes. Now let's move on to some good practices that you're supposed to follow if you want a good back. First is maintain a good posture. Whether you are sitting, standing or walking, keep your back straight and shoulders relaxed. Avoid slouching, which puts extra strain on your spine. Second is exercise regularly. Strengthening your back and core muscles through exercise while walking, swimming, yoga or Pilates can help support your spine. Strong muscles make it less likely for you to injure your back. Third is lift properly. While lifting heavy objects, bend at your knees, not your waist. Keep the objects close to your body. Use your leg muscles to lift, which reduces the strain on your back. Fourth is stretch often. Regular stretching improves flexibility and reduces muscle stiffness. Focus on stretching your back, hamstrings and hip muscles which are connected to lower back health. Fifth is use ergonomic furniture. Choose chairs and desks that support your back, especially if you sit for long periods. Your chair should have good lumbar support and your computer screen should be at eye level to prevent hunching. Sixth is maintain a healthy weight. Extra weight, especially around the belly, can put pressure on your spine, leading to a back pain problem. A balanced diet and regular exercise can help you maintain a healthy weight and reduce the strain. Seventh is wear supportive shoes. High heels and unsupportive shoes can throw off your posture and balance, leading to back pain. Wear comfortable shoes, low-heeled ones with good arch support. And eighth is sleep on a supported mattress. Use a mattress that provides good support and keeps your spine in your proper alignment. Now these were the points which you need to do or avoid doing to keep your back strong. But if you're having back pain, what you are supposed to do? First thing for sure, I would suggest not to rely more on painkillers and muscle relaxants because that is not very good for your body. Your kidneys might have to suffer. Rather, try some natural remedies, home remedies to solve the problem for you. So there are some do's and don'ts which you need to follow while you are having back pain. Let's check them out. First one, rest but stay active. Rest for a day or two. Give your back some time to recover by resting for a short period, but avoid prolonged bed rest, which can weaken your muscles and prolong your recovery. Stay lightly active. After a short rest, start moving around gently to prevent stiffness. Short walks or light activities can help you keep your muscles active without overworking them. Now you can try applying ice and heat. For the first 24 to 48 hours, you are supposed to use ice pack. Apply an ice pack to the affected area for 15 to 20 minutes every 2 to 3 hours. Ice helps reduce inflammation and numb the pain in early stages. While in later stages, that is after 48 hours, you are supposed to use hot water bag or hot bags. Heat relaxes the muscle and improves the blood flow, which can help speeding up the healing. Then gentle stretching and light movements. Avoid complete inactivity. Gentle stretches such as pulling your knees to your chest or doing pelvic tilts can help relieve the tightness in your back. Light walking or moving around carefully can also prevent stiffness from setting in. A good posture and ergonomics is equally important. Sit and stand correctly. When sitting, use a chair with good lumbar support or place a small pillow behind your lower back. When standing, keep your weight evenly distributed on both feet and avoid slouching. Avoid heavy lifting. For the first few days, avoid lifting heavy objects or twisting your back. If you must lift something, use your legs and not your back as explained above. You can also use lumbar support or belt if necessary. For severe cases, a lumbar support or belt or brace can provide temporary support for your lower back. This can be useful for stabilizing your spine while you move around. But if your back pain is not settling, even you have tried everything for 2 to 3 days, then you must visit your doctor and consult. Also, if you are experiencing any kind of numbness or sciatica pain, that is the strong shooting sharp pain from your back to your legs, in such kind of situations also you should not wait for 2-3 days. Go and see your doctor even after the first day. Now the next time whenever you are getting acute back pain, you must start following these steps. See for 2 to 3 days and I'm sure you will get good results even without popping pills. Now I'm sure most of this information is new to you. You were not aware of all these things earlier. So if you're really liking the information, give us a thumbs up. Also share this video with your friends and family members, with your loved ones, because most of them will at some point of time have to face back pain problems, and if they'll have this video handy, they can take care of them much better way. Also, we keep on making informative videos on health and related topics to keep you healthy and live longer without popping pills. So if you are in, subscribe this channel. Now moving on to the last part of this video, the most commonly asked question: how should we sleep? Now let's first see what should be the position while you are sleeping. So if you are sleeping on the back, you have to put pillow under your knees. If you are sleeping on the side, you have to put pillow between your knees. And if the third position is fetal position, where you are curled up. This will prevent disc herniation. It's one of the best position to sleep if you are having any back problem. And the least preferable sleeping position is to sleep on your stomach. But if you prefer sleeping in that position, you should keep pillow under your lower back or your stomach to prevent strain on your back. Apart from that, you must choose your mattress appropriately. It should be a medium firm mattress which will reduce the back pain. It keeps your spine aligned with providing enough comfort. Also use a supportive pillow that keeps your neck aligned with your spine. For side sleepers, a thicker pillow is ideal to fill the gap between the shoulder and head. For back sleepers, a thinner pillow is better to maintain the proper alignment. Also, avoid sudden movement. When getting up in or out of the bed, avoid twisting your body. Instead, roll onto your side, push yourself up with your arms and swing your legs to the floor to reduce the strain on your back. So I hope all your queries are solved. You now understand completely what you are supposed to do to keep your back stronger. I have tried my best to answer all the questions in this video, but if there is something I have missed, please feel free to put your questions in the comment box. I will definitely include that in my next video or answer you on the comment itself. Apart from back pain, if there is some other problem that you are experiencing, some other health issues, and you want answers on that, you can post your question in the comment as well. Well, that's all for today from my end. We'll see each other again in some other interesting healthy content. Till then, goodbye.